I was wondering, can you share your experience of creating and implementing a psychiatric advance directive?
I'm sad to say, Sucharita, but the psychiatric advance directives remain very underutilized. It's a relatively new concept, both for patients and for healthcare professionals, and many are hesitant to approach this topic. I provided education on psychiatric advance directives over the last 15 years. I have spoken to healthcare providers, I have spoken to patients, caregivers, and legal professionals, and everybody seems to be very excited about psychiatric advance directives. However, that excitement rarely progresses into a large number of patients with completed psychiatric advance directives. This is actually not surprising. In a survey of more than 1,000 of psychiatric patients over five different U.S. cities, the surveyors found that between 66 and 77% of patients were interested in completing psychiatric directives if they were given assistance to do so. However, only 4 to 13% of them actually completed psychiatric advance directives. There are many barriers that can contribute to a low number of persons with mental illness who complete psychiatric advance directives. For example, many patients are first asked about psychiatric advance directives at the moment when they're admitted to a psychiatric facility. As you can understand, this is not the best time for them to reflect on the past treatment and grasp the whole concept of psychiatric advance directives. So imagine if this person comes to an emergency room, the hospital, asks them about psychiatric advance directive that they don't have. They offer some flyers on psychiatric advance directives, and nobody ever follows up on that. Patient doesn't have a good chance of completing psychiatric advance directives. In my mind, the interaction could be a lot more fruitful if or there is a follow-up conversation happening towards the end of inpatient stay, or when the patient transitions to outpatient settings, when they have better opportunity to reflect on the treatment that worked and treatment that didn't work for them, and complete the document at the same time. Another concern is that, as I mentioned, all of those documents require to be witnessed and in many cases notarized. Now, if you're in the hospital, there may not be too many people who are able to visit you from the outside, and the hospital staff regulatorily is not permitted to act as witness in many states for the patient. So you may be sitting on a completed document that nobody can witness or notarize. Another thing that can happen is even if somebody is out in the community, for people with mental illness, some of them don't have close family or close friends whom they rely on, and finding somebody who can notarize and witness the document may become more difficult for them. Another thing to consider that in certain states, the law may preclude providing certain assistance to patients or in the process of getting their psychiatric advance directives completed. For example, in Virginia, the state bar declared that providing assistance by a non-lawyer in completing the legal form constitutes unauthorized practice of law. The legislature, they interestingly found a legislative workaround when they said that if you're a healthcare professional assisting a person completing that form, you're not practicing the law, you're practicing medicine. However, this still precludes peer support professionals to provide that kind of one-on-one assistance to persons who are interested in completing psychiatric advance directives.
Wow, there seems to be a lot of barriers for implementation of psychiatric advance directives. Dr. Ravin, can you share your experience when not having a psychiatric advance directive affected your patient care?
We see this in daily practice. We have many patients who get admitted to a psychiatric facility, and they're in acute mental health crisis. They have history of prior psychiatric inpatient hospitalizations, and when they present acutely ill, they're not in the best position to fully appreciate the severity of their symptoms, understand the risk of potentially leaving those symptoms untreated adequately, and that they are not able to fully thoughtfully reflect on all the good and bad things that they experienced in prior treatment episodes. on many occasions that can contribute to delays in care and selecting care that may not be the most optimal for patient. We also have situations when the patients are unable to consent for care at the time when they are admitted onto a psychiatric facility due to severity of their symptoms. And in this case, the hospitals have to go to the court asking for court-ordered treatment. In such cases, that process can play out over a period of days or even weeks, and not only contributes to delaying care the patients needs, leaving them suffering from symptoms of acute mental illness. But even at the end of the day, when the court approves treatment for the patient, it still may not necessarily be the treatment that fully accounts for patient preferences.
Thank you for sharing that experience. And clearly, there are so many advantages, so many scenarios in which having that psychiatric advance directive would definitely make things more streamlined and faster for the patient and their patient care themselves. So, Dr. Ravin, can you share your experience of a time when psychiatric advance directives changed how you treated a patient? So, when the patient came in with a psychiatric advance directive?
I don't have a personal anecdote to share with you today, but I think your question is very timely because right now we're exploring possibility of partnering with the University of Nevada, Reno and the University of Nevada, Las Vegas to get answers to these kind of questions. From what we know from prior research, when patients complete psychiatric advance directives, they're much more likely to report that their needs for treatment were met. They reported better working alliance with their healthcare professionals, and we're more likely to utilize outpatient services. We hope that in the project that we work on, we would be able to gain insights how completing psychiatric advance directives impacts someone's care within 12 months after psychiatric hospitalization.
Thank you, Dr. Raven. Those were some very important points, and I have been making notes as we go. So, before we take your leave for the day, I just wanted to reach out, thank you first, and then ask you for quick closing remarks for patients and for caregivers.
So, first of all, again, I would like to thank PsychU and you, Sucharita, in particular, for your interest in this topic. You know how close it has been to my heart. I would like to mention the Psychiatric Advance Directives is still a relatively new tool. A lot of education still needs to happen. It could be a really great tool that helps patients guide their treatment. However, the tool is only good when you use it. And despite clear evidence that psychiatric advance directives enable patients to direct their care during the time of mental health crisis and improve patient outcomes and satisfaction of patients with their treatment, many patients, caregivers, healthcare professionals are still hesitant to discuss psychiatric advance directives, primarily because of their limited understanding of its nature. I'm grateful for this opportunity to contribute to increase awareness of psychiatric advance directives. And I believe it is a powerful tool that is underutilized, but hopefully it'll be used broader and broader and allow our patients to receive psychiatric treatment that really meets their needs.
Thank you so much. And with that, I thank everyone in the audience who listened to this recording. And please contact PsychU if you have any feedback. And I look forward to seeing you at our future webinars and VLEs.